Hi, everyone. Welcome to a very special episode of our podcast, The Dialogues from HealthOK Global. I'm your host, Kaustubh Mohan. HealthOK Global provides comprehensive eldercare services in India designed to support seniors' independence while giving families peace of mind. HealthOK Global offers 24 by 7 medical and emergency support, chronic disease management, post hospital recovery, medication adherence tracking, and a mobile app for real time updates. And a dedicated care team which coordinates care across doctors, pharmacies, and labs. In today's episode, we are talking to one of our rather special care teams. And before I bring them in, I just want to spend some time explaining to you what care coordination is. So think about this. How many times have you or your parents felt completely lost in the healthcare system? One doctor has one opinion, another one has a different and writes a different prescription. And this causes stress. And then you're running around for test reports, chasing reports. So half of the time, it feels as if it is your full time job. And that is what we are talking to you. HealthOK Global has created a solution. It's something we call clinical care coordinator. We just call it CCC for short. And in this episode, we will see what CCC actually means for seniors, for families, and even for doctors. And the best part, we've got and they'll share with us what they do on a day-to-day basis and why it really makes a difference. So before we start our conversation, let's first get a better understanding of what exactly is CCC. At its core, it is about connecting the dots. Healthcare is often fragmented. One doctor doesn't know what the other has prescribed. There are sometimes there's a need to consult with doctors that have different specializations. Families are juggling medications, test reports gets lost, essentially some amount of chaos, stress, and confusion. And this is where CCC steps in as that missing link. For seniors, care coordination means they don't have to depend on their son or daughter for every small reminder. Like, father, did you take your BP test? Or mother, your sugar test report is done. There's a team is keeping an eye, sending reminders, available all the time, and then seniors feel more confident, more independent. And for families, especially those who live far away from parents, care coordination is simply peace of mind. So instead of worrying every day, there's a health manager tracking everything, sending updates, and being available now. And here's something people often overlook. Care coordination is a huge help for doctors too. It makes sure that patients are actually following the care plan. No more guessing if the medication was taken, lab results will show up, a full picture. And that means better health outcomes. So if I had to say in one line, CCC makes life easier for seniors, families, peace of mind, and helps doctors do their job. Now, the real magic of care coordination isn't just the idea, it's the people behind it who actually make it. Yeah, joined by three amazing members of the care team from HealthOK Global, Dr. Saloni Kavra, Nurse Divya, and our care coordinator Manjeet. Welcome again to this podcast. I'm going to start off with Dr. Saloni. Dr. Saloni, you're both a doctor and a nutritionist. And that's a unique combination. So how does your role fit into CCC or care board?
Thanks, Pastor. For me, CCC is about looking at the patient as a whole and not just treating the disease. Yes, I prescribe medicine, but I also focus on their diet and their lifestyle habits. Um, Take diabetes, for example. It's not just about giving insulin or just diabetes medication. It's also about what the patient eats, how active they are, and how they are able to follow the care plan. I create the care plan and make sure with Manjeet and Divya that the patient is able to follow the care plan. That gap between the doctor visit, that's where the most progress or problems happen, and CCC feels that gap.
I love that. It's not just a doctor visit, it's an ongoing partnership. Let's bring in Nurse Divya, and nurses are often the backbone of healthcare. So, Divya, what's your day-to-day role in CC?
So, Kaustubh, my role is very hands on. I keep a check on vitals, medication, and especially when someone comes home after a hospital visit. Seniors especially need help when they come home after hospital stay. That's where I step in. And the best part is, I am not working alone. I am connected to Dr. Saloni and to Manjeet all the time. So, if I notice a blood pressure spike, I can escalate immediately. The patient doesn't have to wait for the next doctor visit.
So basically, you are the eyes and ears on the ground, and that must give families a lot of comfort.
Yeah, exactly. Even families often tell me that they can relax a little because they know that there is someone checking on their parents on regular basis.
Finally, let's hear from Manjeet, our care coordinator. Manjeet, you are like the glue that holds everything together. Tell us a little bit more about what that looks like.
Thanks, Costa. I'm usually the first person families call. Families call me for updates. Doctor rely on me for test reports, and patients reach out when they need help, like booking a lab or refilling medicine. I also handle reminders, medication alerts, preventive checkup, even arranging home service like nursing or sample collection. For many families, especially if they are abroad, I become their point of contact. They know someone is checking daily. That's trust. And that's very satisfying for me.
That's simply brilliant. You're not just coordinating, you're actually giving families confidence and patients consistency. So after hearing all this, I think it's clear clinical care coordination isn't just about tracking medicines or arranging tests. It's really about people, teamwork, and making life simpler. For seniors, it means independence. For families, it means reassurance. And for doctors, it means better outcomes. And it all comes together because of the care team. Professionals like Dr. Saloni Kabra, Nurse Divya, and Care Coordinator Manjeet. Big thank you to all the three of you for sharing your side of the story. And to our listeners, if you'd like to learn more about what care coordination is and how it can support your family or your patients, you can visit HealthOK Global. I'm Kaustubh Morel, and this was our chat on clinical care coordination. Thanks for tuning in, and I will see you in the next episode. Thank you.